It's also been shown to inhibit growth of neurons in the hippocampus. The hippocampus is the only area in the brain that can grow new neurons in adulthood, and antidepressants actually counteract this effect. So, and stress also has an effect of inhibiting nerve growth in the hippocampus. And there, the 13-CRA, that's 13-cis-retinoic acid, that's Accutane. It's causing a decrease in new neurons, and this is a major model for depression. We showed, published in 2005, that there's a 21% decrease in function in a part of the brain called the orbital frontal cortex. You see there on the right, there's less yellow area in that where this is pointing to, and it was statistically significant only in patients who were on Accutane, and all the people who had a decrease in function also had a headache. And Roaccutane et al. From the FDA showed that there's an association between headache and depression in people treated with Accutane. High doses of vitamin A are known to cause psychosis and depression. It was known from polar explorers of the North Pole, and they're eating a lot of polar bear liver. They had a increase in psychosis because polar bear liver is full of vitamin A. In fact, there's a syndrome amongst Eskimos of people who become crazy when they eat too much polar bear liver or seal liver, which is high in vitamin A. So this association with psychiatric side effects is well established. But in fact, the most important evidence is from this FDA meeting in the year 2000, when Marilyn Pitts presented 41 cases of challenge, de-challenge, re-challenge, meaning that people got depressed on the drug and then they recovered after stopping the drug and became depressed again. That alone, according to the textbook of pharmacoepidemiology, is proof of a causal relationship. So this has been proved for over 23 years. I'm not sure why dermatologists continue to claim that there's no evidence for an association. That's simply false, and to say otherwise is, in my opinion, malpractice. Wysowski also presented over 400 cases, and then the final piece of evidence is this Azulay, the prescription, the case crossover study, in which they showed a 2.68-fold increased risk of people who've been treated with isotretinoin compared to those who'd not been treated with isotretinoin. So, so that together with the the 41 cases is, in my opinion, has established the fact that it can cause depression. And I wrote a paper that you can find on the internet called Isotretinoin and Neuropsychiatric Side Effects, Continued Vigilance is Needed.